The PSMAfore study was a presidential symposium session at the ESMO 2023. I was one of the PIs and authors for the VISION study. We were one of the leading enrollers. And so in the VISION study, patients had to progress on taxane, at least 1 or 2 lines of taxane, oral androgen receptor pathway inhibitor. And so to build on that study, this study actually studied the use of Lu-177 for patients before taxane. And so there was a very mixed response in terms of the study results. On the one hand, you had a very high complete response. You had a very high response rate. But on the other hand, overall survival crossed over into above 1, and it was 1.16. And so that's something that we have to kind of keep an eye on. The study is still very immature, but since the overall survival is greater than 1, that does raise the question whether it's going to get approved for regulatory programs and so on. So overall, I think the key here is to kind of follow up on this study. This is a very effective medication. As a GU oncologist that practices, there are a lot of patients that do not want to receive chemotherapy, whether it be docetaxel or cabazitaxel afterwards. So this is a very important study that we have to kind of keep an eye on, and keep an eye and talk to our patients and see if we can maybe get this medication that's highly effective in a pre-taxane state. So, but overall, I would say that we still just need more data and follow up on the PSMAfore study. This is a great event. I think the one thing they changed up this year and added to was you all had the young stars, and so all the different people, the junior stars, came in, presented their research. And it was very profound because they presented the research that they want to present in terms of the study design, but then they had access to all of the leading GU oncologists in the field. So if you had for instance, one of the junior stars presented a concept about bladder cancer, and it was a very effective study, the use of carboplatin, gemcitabine, cisplatin, gemcitabine, post enfortumab vedotin, pembrolizumab. And to have somebody like Dr. Chopra Gupta, having Dr. Rosenberg and Dr. Petros-Grivas to actually talk to them about the study design so they can get real-time feedback, I think was very invaluable. Also with the other GU oncologists in the room, just to see how the things work behind the scenes in terms of study design, I felt like that was very invaluable this year for this year's event.